So, good evening, everybody. A very warm welcome to all of you on the platform of Homeopathy 360 in the webinar series, Beyond Boundaries with Homeopathy 360. So, we have been bringing to you many different teachers from around the world in this homeopathy webinar series. And today, because we've approached the month end, we have some very special episodes which are being broadcasted, which are being conducted in collaboration with the HHF. Now, for those of you who are unaware of what is HHF, although I've always maintained that HHF is a brand in itself, it needs no formal introduction. Yet, for those of you who are beginners either to this platform, to this series, or who are the newcomers in the field, I'll quickly take a minute to introduce you to what is HHF. So, HHF refers to Hahnemannian Homeo Forum. As I said yesterday, it is a team of very senior, very eminent homeopathic professionals who are keen on teaching homeopathy, who are as passionate about teaching homeopathy to the newcomers, and they come together with one single aim of making you better at your work as a professional and enabling you to flourish your practice as a homeopath. So yesterday we had spoken to one mentor from the HHF group, Dr. Pallavi Chaturvedi, and today we are welcoming on our platform Dr. Jowin Jacob William. Welcome, sir.
Thank you.
So before we begin, sir, a little, I'd like to introduce you to the audience. So Dr. Jowin completed his BHMS in 2008 from Kolhapur, and since then he has had an amazing homeopathic practice for the past 15 years. And I'd like to tell all of you that he is a direct student of Professor Dr. George Vithoulkas in the IACH course. And today in this webinar, this is going to be very interesting because we'll be talking about homeopathy in deep pathology cases, how to deal with cases which are advanced in pathology through homeopathy. So now, before sir begins his presentation, I'll quickly acquaint you with the interface. On the bottom of your screens, you have a button which is more and a button which is chat. So any time during the presentation, if you have any questions, you can type in the Q&A box is given. When you click on more button, you have a Q&A box. You can type your questions there, and you wait because in the end, I'll be taking up as many questions as possible. So, sir, can we begin?
Yes. Thank you very much, Dr. Rashi. Thank you for this introduction and thank you for the platform. And I'd like to begin by saying a very good morning. Good morning intentionally because in HHF, we usually start with a good morning. A morning has a very different energy.
True, sir.
Like we are starting something new. Ek josh rehta hai. So let's start with a very good morning to all of you. And as the topic suggests, we are going to look into cases of deep pathology and how we manage it. So it is no rocket science, or we don't do anything very different when it comes to cases of deep pathology or advanced pathology. So initially, I'd like to start with a few tools that we have at our disposal while tackling such cases. Yeah, we have our normal case taking where we have the name, age, address, and everything that goes in a sequence. And then there is this dynamic case taking where you go with the flow of the patient, right? So that is more effective because you see, you react as the patient reacts and you get more information, more genuine information. Communication that happens between the doctor and the patient many a times is filtered. The patient gives you information that comes filtered through here and not 100% genuine. So you have certain tools at your disposal from by which you can, get to the core of the patient and thereby to the core of the remedy. So I'll start my presentation. So let me begin with gratitude first of all. Gratitude to God Almighty, to Hanuman sir, because of whom we are all here. We are all blessed to be homeopaths. We are all blessed to be practitioners of this beautiful, wonderful, divine science. Yes? And all these pioneers who have put in their heart and soul, blood, sweat, and tears into giving us uh, all the great material that we have today. Yeah. Gratitude to our masters, Mohanty sir, Gupta sir, and dear Rao sir. It was Rao sir's dream that we have a platform where we can come and share, where we can come and come together and learn homeopathy. And because uh, a single person will go far, but together we can do much more. That is the motto that Rao sir had in his life, and we are in HHF and we are practicing good homeopathy because of him. And extreme, I mean, deep gratitude from the bottom of my heart, from the bottom of the heart of all HHFians towards all these gurus. To our mentors, Sunil sir, Mayur sir, KY sir, and Nikhil sir, and entire HHF family. Okay. So, approaching any case, you have the what, the how, the why, and the when. The what is what the patient says to you. Okay, everybody's with me? What the patient says, the subjective, whatever he's saying, the words that is coming out of his mouth. This is the what of the patient, and it carries less value in the course of things because ये अगेन फिल्टर्ड इंफॉर्मेशन है. आप एक सवाल करते हो, उसका एक रिएक्शन आता है, वो सोच के उसका जवाब देता है. That is how it goes. But the how takes more importance. The how is how the patient is expressing what he's expressing. Right? So when a patient says, when you ask him, what do you feel about him? I feel so sad, doctor. And when a patient says, full वाट लग गई. So, and full वाट लग गई, इतना दुख हुआ ना डॉक्टर, इतना दुख हुआ. That dukh of the first patient and the dukh of the second patient is entirely different. The body language is entirely different. Right? And the why takes more precedence, especially in cases of deeper pathology, because you have to address the cause from where this pathology has come, why the person has fallen sick, and when is also associated with the why, because it gives you the never been well since. So the chronology of the events that has taken place in the life of the patient and from where the pathology has developed takes has great importance. We'll go through this. I'm going through fast because we'll see practically how all these things add up with the help of two cases today. Next is the concern, adaptation, and reaction. The concern regarding the pathology, the problem that the person is presented with, his adaptation, how is he adapting to that particular situation, and the reaction, the emotional reaction to that situation. For example, what is your concern regarding this pain that you have now? Well, the कल doctor बहुत बड़ी party and I don't want to miss it. I want to enjoy fully. This is the concern of one patient. The other patient may say, this pain can become, I don't know what, it may lead to some frozen shoulder. I'll be suffering for it for my entire life. This can be the another type of concern, right? Adaptation is how he is managing that situation. So two people with frozen shoulder or shoulder pain will come to you maybe within a week, and some will let it go for a year and then show up for a treatment. Why? Because हाँ ठीक है हो जाएगा लगा था. अभी क्या है ना, अभी थोड़ा ज्यादा हो गया. Now it has increased. Now I'm not able to do my daily routine. That is how he's adapting to his shoulder pain, right? Reaction, I'll give
Sir,
you very
I'd
funny.
like to intervene in between.
Yes.
A student has requested that they're not well versed with Hindi. So if you use
Oh,
Hindi words, if you could explain in English also.
sh should I? I didn't get it. Completely in English? No Hindi at all?
No, if you use Hindi words for
Acha.
maybe other students, so
Okay.
please just once repeat the sentence in English so that she can understand. So she's
Great.
not
Oh,
very well versed with Hindi language.
Okay, done that. Okay.
Yeah.
So when
Please
it
go ahead,
comes,
sir.
yeah, when it comes to reaction, I'll give you a very funny incident. Amol Rane sir, and he was taking a case of fourth stage cancer. And he was a Malayali patient. And he asked, what was your reaction when you heard the news, Ki you have cancer and it's fourth stage? And he was like, मजा आया ना डॉक्टर, बहुत मजा आया. The reaction was like, wow, it was so much fun listening to such beautiful news, wonderful news. The reaction was sarcastic. It was witty. So these are all things that helps you differentiate and come to a remedy and understand the peculiarity of the person. Right? Next tool that you have at your disposal. Again, you must have heard from Pallavi ma'am also. It is the IPR, interpersonal relationships. The way the person interacts with his immediate environment, with his family, with his colleagues in the social settings. All these play a part in understanding the man in the disease. Right? And psychodynamics is a relatively new thing, which Rauser had worked extensively on. And this focuses on what emotional uh, incident, what emotional cause is behind the development of the pathology. So you can go in reverse. Say if you have a right knee joint pain, you can, with the help of psychodynamics, because the right side indicates either the spouse or partner or business relationships or professional front. And you can ask questions relating to that. The knee indicates certain other things. So it is a very advanced sort of a tool that we have at our disposal when we come to treating pathologies. Okay. So we'll understand these things with the help of two cases. Hopefully, time will permit. And I'll go to the first case. So the first case was of a 35-year-old male who was suffering from severe allergic rhinitis. Okay, it started off as allergic rhinitis. He came to me, and it has been since 2 months, and in those 2 months he had lost 12 kg weight just because of allergic rhinitis. And I was like shocked. इतना weight कौन lose करता है सिर्फ सर्दी से? Who loses so much weight in 2 months just because of runny nose? And there was nothing else. He used to soak napkins all night. He couldn't sleep. And no sneezing, just runny nose, watery nose. I treated him for 1-2 months, nothing. And his weight kept on decreasing. And then I sent him to an MD medicine to get it diagnosed. Bhai, kuch aur to nahi andar. Is there any deeper pathology? And then the X-ray and ESR and everything suggested possibility of COX. But there was no cough, no fever. Possibility of COX, slight blunting of the CP angle shadows. And they had suggested you go to a pulmonologist. There, it was ruled out. He was not given COX treatment, AKT, and he came back to me again. Then I took his history again. So his appearance, this is the how. This is the appearance. This is the objective, what you observe in the patient. He was lean, thin, wearing oversized shirts. Of course, he has lost a lot of weight, big eyes, a cheerful demeanor while speaking. Like that. Okay. Animated and lively. And despite, Abhi, if you can imagine, if I put myself in his shoes and have a dripping nose all night for months together and not able to sleep, I will be cranky as hell. Yeah, I would be cranky as hell and I pura ghar sar pe utha dunga. So this was not the case with him. He was quite calm and composed despite the severity of his problems. Okay. Next, he came with his wife and 8-year-old daughter. Wife was more talkative. Wife was giving the chunk of the history. Husband kept quiet while she was talking. These are all the observations. Reaction to illness was okay. He was calm. He was composed. He was never irritated. And the PQRS was the only daughter. You know how the daughter-father relationship is. It is different. It is how it is very close. And the father, he used to keep his daughter away at night to mere saath mat so, don't sleep near me because you may get infected. You may get an infection. That's why he used to keep her away at night. He used to sleep in a different room. Okay. And when you ask, bhai, what else? How's life? And he was like, life's good. Life's nice. I'm settled. I have a good job. I have a good family. I've bought a house and this and that. Everything is fine. Everything is good. And the body language suggested, and the body language was so clear that so good, so good. And you could feel that he is not in any way lying to you. That whatever he was saying was genuine. So here you are in a fix. Then why the hell is your nose dripping all night? If everything is genuinely so good, why are you getting this runny nose? Why are you losing so much weight? Why is there a possibility of coughs? And then we go further into the history and you get incident. This person had his neighbor approached him and told him, my relative mother or someone needs immediate surgery and I need some money from you. And one day he said, no, I can't arrange. The second day he came and he was like, please help me out somehow. And this guy took out his credit card and gave him his PIN number and use whatever, however you want. And that person went and bought quite a lot of jewelry for 3 lakhs in his name, on his credit card. And this incident was narrated by the wife. And he was like this. When the wife was saying this, he was like this. And the words of this wife, एक किस्सा हो गया, ये तो आदमी देवता है हमारे. This man is like God. He wants to help everyone. And he was like, so this was one incident that gave, an insight into what this person is. So I asked him, what do you feel about it? So he said, see, we did it with a good intention. I did it with a good intention. I'm not worried about it. I have all the evidences. We have put a case and we'll get the money. And if I don't get, what is money? Today it's there, tomorrow it's not. So, and look at the hand gestures, the open palm. You feel the guy is communicating with you honestly. There is no closure. There is no defensiveness. That you don't see. Okay. Then you understand, the wife said ki inki bimari, his illnesses never go off easily. Every year he has to have some illness or the other, and it lasts months. He's been admitted for pleural effusion and has had Cox treatment earlier when he got married, immediately after marriage for 2 months. Then he got malaria, admitted again, months, medication for month. Malaria, typhoid, month. Each disease has lasted more than a month. The wife said, मेरी जब से शादी हुई है, since I have been married, I means not we, since I have been married, he has been sick all this time. And then she realized what she was doing. I mean, he was sick earlier also, but every year, he gets this big illnesses. And now you see a bit why he's getting sick. देवता है पति हमारे. This sort of tone, this sort of nagging, this sort of bickering at home. And it is somewhere hurting his, at this point, you can say it is somewhere hurting his dignity, his self-respect, his self-esteem. And the nose is bleeding. Sorry, the nose is running. What is the nose? It is the seat of your self-respect, your dignity. समाज में नाक कट जाती है. It is a saying in Hindi. I don't know how to express it in English, but you have cut my nose in the society. That is the literal meaning. But you don't say आँख फोड़ दी या कान कट गया. It is the nose. It is the self-respect. It is the dignity. Right? And when I asked, what is your concern about this? Now that I've been treating you, the other physician has been treating you, it has been months, you've lost so much weight. What is the concern? कहीं निमोनिया अभी अंदर क्या होता है किसको पता कहीं निमोनिया तो नहीं हो जाए. And he was laughing and expressing his fears. He was saying कहीं कहीं निमोनिया तो नहीं हो जाए. This was the sort of reaction. Isn't it peculiar? Isn't it PQRS? Right? So would anybody who is not HHFian, I think HHFians know this case and know this remedy in and out. Anybody who would want to like chat and tell me what medicine they could come to, or what is their analysis or understanding of this medicine, of this patient. Dr. Rashi, can they speak, or should I check
Sir, they can chat. They can write their comments in the Q&A box.
Okay, Q&A box. All
Right.
right. Okay, let me then just move on with the second case. Would that be okay?
So you can open the Q&A box and it will be visible to you simultaneously along with the screen. You'll be able to see the Q&A box.
Yes. Dr. Saroj Bagh says belladonna and stramonium, sulfur, bella, phosphorus, feel of belladonna. Very good. Neha Pawar, feel of belladonna. Epis, sulfur. Could be a content remedy. Very good, Dr. Veena Krishnan. Okay. Cannabis, question mark. Okay. All right. We'll differentiate then. Phosphorus 1M, along with the potency, that's quite confident. Dr. Zoish Patel. Great. Aurum Met. Yes.
Aurum Met, hydrogen.
Hydrogen. My God. No, it's not that.
Cocculus and sulfur.
Okay.
Apis, belladonna, bell and
Belladonna is
staff.
coming out quite strongly. Yes. Belladonna should come in your DD. Dr. Neha, Dr. Olive Sack. Bapre, apne HHFian hai, Jaskaran Singh. Okay. Anyways, okay. We'll go to the next case. Acha, follow up after 3 days after giving the remedy. Sleep was better. The discharge had reduced. Appetite got better. He used to, at a sitting, he used to eat 8 chapatis and 8 rotis at a time. That was, and because of this discharge and all, he had come down to 2. That I forgot to mention. Now his appetite is better, and that's how he lost so much weight. Okay. No discharge in 15 days, sleeping well, eating well, and after a month, sustained relief and 2 kg of weight gain. Emotional level, you won't be able to find much changes in these patients, and I'll tell you why later. Case 2. Second case was of a 60-year-old male with diabetes since around 20 years and had developed osteomyelitis of the great toe around 6 months back, and the toe got amputated around 4 months back. Great toe amputated 4 months back. The wound has not healed since. There was a new wound that had developed on the dorsum of the foot since 2 weeks, also not healing. Okay, this is when he came to me. The PQRS of this was, he went to the surgeon, the general surgeon who had done the surgery, and he was calling him for regular dressings and all, and he used to go religiously. For 4 months, never did he utter a word of negativity towards the surgeon ki kya ho raha hai, kyun theek nahi ho raha hai, what is this, why am I not getting better, nothing. He used to just go, get his dressing done, give his fees, say thank you, and come back. The surgeon felt guilty. अरे यार ये आदमी ठीक नहीं हो रहा है मुझसे, and I'm just, he's not getting better, and he's a good friend of mine. He called me, let's start homeopathy. Very good, let's start homeopathy. So you get an idea about the character of this person, right? He looked absolutely like Santa Claus. Boring Muslim person, chubby cheeks, bit stout, a very sweet and innocent look. He spoke also very bubbly type. Huh? And I asked him, when you heard this for the first time, your toe needs to be cut. Again, concern adaptation reaction. when your toe needs to be cut. When you heard this, what went through your mind? होश उड़ गए, दहशत हो गई. The what is saying something else. The how is saying something else. The what is a fear. Dahshat, hosh udna means I was scared out of my wits. And the how, the presentation was cheerful. And my concern now is I don't want to lose the rest of my toes. That should be intact. Okay. So here is an example of how IPR helps you. I asked him, who are there at home? 2 sons, grandchildren, daughter-in-laws, one daughter who is married and doesn't stay with us. And he stopped. And I was waiting for him to complete. What is wrong with this? No mention of wife. So I asked, wife? He was like, hey. I asked wife.
Meaning she's
He was
there.
like, pardon me?
She's there. She exists.
She's there. She's there. I asked wife. He
Hannah.
was like, huh? I mean, wife? है ना? है. तो घर पे ही होते हैं. She's at home. हाँ, yes, she's at home. Okay. Then we went ahead. An hour of case taking, and I could not get to the why. Why? What caused this pathology? What was the emotion? What went wrong in his life that his toe had to be cut off from? What was so wrong in his life that his toe got infected so bad? What is the wound in his heart that is not healing, which is not allowing the wound to heal physically? Nothing. The psychodynamics part I tried to apply there, but did not get anything. Okay. This is also important. Whatever is seemed again genuine, open palm gestures, no defensiveness, no secretiveness, nothing from the IPR either. I asked the son, what is he's very cool, he's very shant, he's whatever you see in front of him, it's generally what he is. Only one worry, kids don't go to the shop on time. He has a dairy ka shop. And his kids are very good, hefty kids, big guys, but they don't wake up on time and they don't go on time. So what do you do? What is your adaptation? What do you do at this time? I call them a few times. They don't respond. I limp away to the shop myself, open it and sit there. This is after the amputation. He goes to the shop himself so that the shop opens on time. But why do you do that? Because that is the philosophy of दूध का business. एक तो दूध को तुम बेचो, नहीं तो दूध तुम्हें बेच देगा. These are his words. Either sell off the milk, or the milk would eventually make you a pauper, make you poor. You will be at a loss. So I have to do it. Okay. Then so from this, I said, don't get angry on your sons. Why don't you get angry? Just, nikal abhi ghar se, bahar ja. Do what you're supposed to do. But then, no, I don't. But why don't you? But it's just not in my nature. So I said, don't you ever fight? Like, don't you have any altercations at your place where you work, at home? झगड़ा नहीं करते क्या कभी? Don't you ever fight? The last time I fought, this case was taken in 2018 or so, and he said the last time I fought was in 1984. Well, 1984, I was born then. So what happened? So he was young and he had some friends and they were joking around. There was some misunderstanding. He stood up against those friends and said कि मेरा पैसे का खाते हो और तुम मेरे साथ ही ऐसा करते हो. He said something like that. कि I pay for all your indulgences, all your this thing, and you're dependent on me and you're only saying bad things about me. He stood up for himself. And then that night, they were drunk, probably the friends were drunk, and they attacked him with swords, apparently. And he also fought back. But then it became a big police case and everything. And he had to go around doing all those case and police and everything. So from that time on, he says, my philosophy is, एक गाल दिया, अगर एक गाल पे मारा, दूसरा गाल भी आगे करो. Present the other cheek as well. I don't go for any fights. Thank you very much. Oh, you want to hit me? Here you are. This has been his philosophy since then, his life's philosophy since then. Right? So I said, now what is your concern about those toes? Of course, those toes shouldn't go, the rest of them. And sugar. इस sugar में आदमी खाए भी तो क्या खाए? What should I eat? I've been doing this restrictions, food restrictions and diet restrictions for so long. What can I eat after all? This was the main concern. I asked him, how did the diabetes start? He had the milk business back then, and they used to make sweets also made from milk late into the night. And when he used to get hungry, he used to eat like pav kilo peda kha liya. Yeah, he used to eat like 2 packets of cream biscuits and all. And one day this happened, and he felt dizzy and got checked and found that it was diabetes. Okay. So this is day 1 of treatment, and this was how he came to me. The photos were sent to me by the treating surgeon. And if you can see, the first pic is the main wound, the amputated. The one that is marked was made by his grandson when he hit his leg with a feeding bottle or so. And this wound came up, and there's a third wound on the sole. This is 15 days after treatment. This wound's healing up. These are also closing up, and this, you see the granulation tissue, it has reddened up. If you see the previous one, the color is different, and you see after 15 days the color is different. It is dark, there is granulation tissue forming at the edges, and the wound had started healing. After a month, it had almost closed, and this was the last pic I could get from him. Almost done. I wanted to include this pic because even after the treatment, when I used to check status, he never keeps this WhatsApp ka status, never. And the one time he did, it was this. It was food. Okay. So let's check the Q&A box, and both the cases, the remedy is the same. Okay. So who would like to, yeah, let's check. Beautiful remedy learned from you. Okay. Opium, yes, very close. Merck iod flav. Oh, great. Merck iod flav, very good, very good. Bearing capacity is very high. Opium, DD, NatCap. Opium, peel of NatCap. Merck sol, natrum carb, graceful withdrawal. So the remedy is indeed NatCap, and give yourself a big round of applause because the remedy is indeed NatCap. Okay. So let's move ahead and understand a little bit about this wonderful, beautiful remedy. So in the case of allergic rhinitis, I had given natrum carb 200 and followed by 1M. So you see the rubrics taken, content, सब कुछ है, सब अच्छा है, the body language, the demeanor, and whatever he's saying was he is happy with what he has. The job is good, wife is good, life is good, घर है, गाड़ी है, बंगला है, मकान है, whatever, he is satisfied. Okay, that is content. And he was cheerful, quite cheerful in his demeanor. Benevolence, because he had that helping mentality. He gave up his credit card to a person. Who does that in this day and age? Right? And he has this philosophy ability. I think I did not mention. I asked him, what did you do when when you realized that this person had tricked you? But I called him, I got very angry. And the wife was like, what angry? That anger does not have any effect on anyone. What angry? So, what did you do? Did you curse at him, swear at him. No, I never curse or swear. Why? जो मुझे सुनने में अच्छा नहीं लगेगा, मैं किसी को कैसे बोलूं? If I don't like hearing something, how am I supposed to say that to someone else? Beautifully he said. And this selflessness, where he kept his daughter away at night because she should not get infected. Of course, the father loves the daughter a lot, but he was like, no, तुझे कुछ नहीं होना चाहिए, तू दूर रह रात को, दूर. He kept himself last, his wishes, his desires, his needs last, and he said, you stay away. I'll move myself away into a different room and stay away so that you are not infected. Okay. For the second case, again, he was content. He was persevering with the surgeon for 4 months without complaining. Right? And government. What was his concern? Aadmi khaye to khaye kya? And you saw the status ka pic. Only food. Okay. So you put those together, you again get natrum carb. He was given 200 OD for 7 days. So to understand nat carb and what makes natrum carb click, why he reacts the way he reacts, why he does what he does, you should understand what is dignity, right? So in this whole slide, the first line is important, and that is human dignity cannot be defined. It is not something you can define in words. So how do you understand? You understand it by its attributes. Okay. So what is dignity? Dignity consists of many overlapping aspects like respect, privacy, autonomy, self-worth. Okay. Dignity therefore means that in any setting which supports and promotes dignity does not undermine a person's self-respect regardless of any difference. So a person who is dignified will act in a particular way, will act in a very honorable way, will act in a way that does not bring his level down in any way. In any way. So here are a few clips that I had taken from KY sir's lecture that we had in lockdown. So dignified, having or showing a composed or serious manner that is worthy of respect. A dignified person is someone who acts politely and minds the manners in a difficult situation, right? Is one of the most important things to a human spirit. It means being valued and respected for what you are, what you believe, and how you live your life. Key virtues are accept all, see value, don't judge, no gossiping, no shaming, be proper and polite, listen more, talk less, have composure at all times. Does these qualities not define the patients that we saw now? Right? Ego, what is the difference between ego and dignity? Ego speaks of I, me, myself, what I did, how I am not wrong, what the other person did is wrong. I did this, me, myself. And dignity speaks of a level. Like, this is beneath me. I will not stoop down to this level. That is why the people in the rubric dignity don't usually fight or do things that would bring their image down, right? Natramur, if something is said to them, they will answer politely, they will keep their stand, they will answer politely and leave. Natramkar, cheerful. You won't even know whatever wrong has been done to him has affected him or not. Natramkar, again. Dignity, a dignified person won't leave his level and come down to the other person's level and fight. He won't. Bargaining nahi jamega. Bargaining needs you to be a little shameless and come down to one level. Dignified person finds it difficult to bargain also. Right? Next. Few important rubrics of NATCA we'll see. They are naive people. Bhole. Bhole. That's why the person could be fooled into getting the credit card and into the fraud, going into the fraud. Right? I'll narrate an incident. My friend bought his cousin to me during this lockdown period or somewhere near, and he had an interview for the visa. And he was like, I'm very scared of interviews, and can you give me something that it goes well? And he was again very cheerful and chirpy, but he was anxious. So I asked him all the questions, and I turned on the AC, and there was mist coming out from the AC. So he asked his brother, my friend, "Hey, what is that?" And he's a like I said, naughty kind of a character, my friend. And he said, because it's COVID, it's spraying disinfectants. And he was like, "Achha." He would believe, like you would say anything and they would believe. And that is the naiveness. This naiveness you find in their facial expressions. They're like this, oh, ah. And the way they can be fooled, right? Having or showing unaffected simplicity. Unaffected means it is, again, whatever I was doing, the honesty, it was not, affectation means वहां पे कोई filter नहीं था. They were not trying to hide anything sort of with their body language. Unaffected simplicity of nature or absence of artificiality. Having or showing a lack of experience or judgment in information. Again, naiveness. They are cheerful people, very cheerful. At the same time, they are fearful. This is a very important prescribing rubric for natrum carb. Cheerful but fearful. Only one natrum carb in this. So when he was saying, pneumonia to nahi ho jayega. Fear in expression, fear in speech, in the words that he is saying, and cheerful in expression. दहशत हो गई, हाँ, दहशत, fear, but cheerfully expressed, quite close to affectation. Stramonium also shows, Stramonium also tries to hide his feeling, but it is exactly opposite. Stramonium tries to hide his fear and laughs. मैं कहा मुझे थोड़ी डर लगता है, अच्छा. And here he is expressing his fear with a laughter, right? So this is different, slightly different from affectation. Of course, there are governments. 90% of NatCap cases, I confirm with this CT confirmatory question. खाने पीने के मामले में कैसे हो? How are you with respect to your food and eating habits? And they love food and they love eating, and they have usually one particular item that. And then I ask, if you have paneer today in your food, how much would you indulge? And they would be like, yahan tak bharne tha, till it fills up to my throat. And they love it, they revel in it. But once you say ki nahi, from today onwards you can't eat paneer because your cholesterols are high, off the charts, you can't do this, you can't do that, they are in the rubric self-control increased. No paneer, okay, thank you very much, no paneer from today. Yeah. And this self-control is not just with respect to food or their desires or their cravings, it is with respect to their emotions as well. That is why they are so dignified and they can keep up their dignity in front of others, right? You throw bombs at them and they'll be, oh, okay, sorry. Okay. And they'll be, oh, good. Yeah. Because they are in harmony desire. They don't want the environment to get nasty with the fights and this thing, nothing. सब शांत रहो, सब खुश रहो, सब अच्छे रहो. Everybody be happy, be together, be in harmony, and that's what he likes. So if that needs taking a step back and saying sorry, he will do that. But he will not lose his dignity. He won't come down to their level to keep their stand and fight. No. Okay, okay, all right. And this is a sign of selflessness again, because they think of more about the people, their IPR, just like the first person was. Second person also, the kids were not getting up. Okay, don't get up, I'll go. Even though I'm lacking a toe, I'll limp my way to the shop and open it. Right? And they have a delusion of being a martyr. Martyr is what? Who lay down their lives for the betterment of others, for others. Again, a shade of selflessness coming in. So if it means so much to you, if being right is so important to you, if it satisfies your ego, even if you are wrong, even if I am right, I concede. This is the reaction. Ye gaal pe maar diya. I'll present you the second cheek as well. Thank you very much. I concede. Let's maintain harmony. And despite, this is the martyr feeling, a person who sacrifices for value or for the sake of principle, for their dignity. Despite all this, they remain content. They don't bicker. They are not bitter. They will not get angry. They are, aha, sab acha hai, very good, all good. And you tend to believe these guys. Yes, of course, everything is good. Then why your nose is running? Why your toe has to be cut? Right? True contentment is not having everything, but in being satisfied with everything you have. True contentment is not having everything, but whatever you have, you are satisfied with it. Ah, very good. I don't have a BMW. My Maruti 800 is wonderful. I love it. It is good. It is enough. It is sufficient. जो प्राप्त है वो पर्याप्त है. अब ये हिंदी में जिसको समझा वो समझा. I can't help it. Okay.
I'll help you there, sir. What
Yeah.
you have is enough.
What you have
That's
is enough. Yeah.
yeah.
Yes. Yes. Thank you. Which is expressed in a philosophical manner by these people. They take the help of philosophy to express themselves. दूध है, तुम नहीं बेचोगे तो दूध तुम्हें बेच देगा. जो मुझे सुनना पसंद नहीं है वो मैं किसी और को कैसे सुनाऊंगा. Milk is something that perishes. If you don't sell it, it will make you perish. And the things that are so harsh on my ears, how do you expect me to say those out loud to other people? Again, philosophy. You adopt. Philosophy is adopted from other people, right? And this is the graceful withdrawal of Natramkar, which is the core theme of Natramkar. They withdraw gracefully because in such situations, they prefer to take a step back rather than to come down and fight and lose their dignity, lose their composure. They say, okay, thank you very much. Sorry, my mistake. Won't repeat it. Yes, bye. And they take a step back. I narrate you an incident in my family. So my aunt, very beautiful Natka woman, and my sister's wedding was going on, and my father was busy wrapping something, gifts or something, and she came up with some suggestion to give my father, and my father is a hothead, and he just gave her a look. She came from behind and muttered something in his ear, and he gave her a look. And she was like, okay, 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 okay. And she stepped like half a meter back, a meter back. Okay, 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 okay. Gracefully withdrew. Okay, don't worry. Carry on. Graceful withdrawal. Jan Scholten says graceful withdrawal is a term that can be directly deduced from the group analysis. It is one of the main themes of Natramkar. They would rather be alone in dignity than feel denied by others. Another example, if this is a hypothetical example, like Mayurish sir always says, newlywed couple, the wife is sitting on the backseat of the scooter, puts a hand romantically on the shoulder of the husband, and she's about to put a chin there. And husband, hey, sab faltugiri mujhe pasand nahi. I don't like all this in public. And she'll be like, okay, 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 okay. Never in my life am I going to touch you again. Thank you very much. Sorry. Gracefully withdraws, but she's never bitter. Unlike Natramur. Okay. So we'll see a little bit of differentiation between Natkab and Natmur. You feel कि बंदा कुछ तो छुपा रहा है. कैसे होएगा? How will he get so much pathology without being affected emotionally? So you feel that he may be secretive, but that natrum carb is not there in secretive. And you are in a fixed key. Body language also suggests that he's not hiding anything. He's not in the rubric elements from suppressed emotions as well. How do you explain this? Okay. So it is the story of repression versus suppression. Natram Moore knowingly they suppress their emotions. Okay, I should not react. It will hurt my image. I'm not going to react. I'm just going to leave. It is a voluntary suppression, forceful or conscious subduing of one's impulses and desires, often negative. It is suppression. One is aware of the negative impulses, again, suppression. It is the conscious mind which is performing the task, again, suppression. In repression, there is an unconscious subduing of the emotions. The person does not know he is doing it. The other person has hurt you and you are bound to feel angry. This registration is not there. It directly goes into the subconscious. It is an unaware suppression of emotions, right? It is the subconscious mind that is at work. This is just to understand why this Natram Kav is not there in these rubrics. Okay, so suppression wala, breathe. Let's breathe to 10. Okay, now I'm okay. Yes, suppressed it consciously. And the repression wala, what would you do? He puts on a cheerful front. He does not even realize that he has suppressed the emotion at that time. It goes directly into the subconscious. So when you want to retrieve that suppressed emotion, you can just go like when you once you've deleted a file from your computer, you go to the recycle bin and get it. It is easier. But if you press shift delete, it is gone for good. You need special tools to get it out. Similar case like Natram Moore, they suppress it and they know they have suppressed it. They know those emotions are there, but they won't reveal. That's why they are in secretive. Natram Moore doesn't know only, Natram Cup doesn't know only. How would you retrieve those information? That is why the disparity in the psychodynamics, everything seems good. Why are you getting so much pathology? Right? So Natram Moore, Catherine Coulter very beautifully writes, cultivates grief, likes to live in that grief, likes to live in that indignation, that mortification. And she sows those seeds, waters it, reaps the grief, and likes to live in it. And whereas Natram Kar gracefully withdraws. You see many rubrics related to chill, and you see a rubric saying cheerful chill during. What is chill? Chill is a cold environment, a non-conducive environment. The IPR is cold, but she's still cheerful. He's still cheerful. The wife, he forgot about the wife. Why do you think? The wife is a chilly environment at home. And it was subconscious. He just could, okay, wife is there. And yet he was cheerful. Delusion thick he feels that nothing affects me. My chamdi is moti. I am thick and nothing affects. I'm good. Selfless and martyr we have already seen. Yeah. Natram Moore is in affectation. Natram Kab is in cheerful yet fearful. Natram Moore is objective reasonable. Objective reasonable is when you say something, you give a reason for whatever you have done and it comes out with ease. And you are like, yeah, whatever he is saying is logical. Yes. Your head goes like, yes, right, correct. Whatever you're saying is perfect. Yeah? And Natram Kav has more of philosophy in his language. ये कह के गए हैं कि ऐसा है and this person has said life is like this and like that, right? Natram Moore is in the rubric deceitful, sly, but Natram Karv is naive, bhola. Natram Moore delusion, wretched while looking in the mirror. They feel, what am I? And Natram Karv feels, nothing affects me. I'm good, I'm cool, right? Natram Moore is in selfishness. Natram Karv is in selflessness. Diametrically opposite. Natram Moore is boaster. He boasts about the ways in which he has kept his dignity alive. He's stuck to his dignity, his morals, his principles. Natram Karp has anxiety about himself, just like Cilicia, just like the patient I said who was afraid of interviews. To boast, you need that confidence. They don't have. They can't boast about anything. They're like, oh, how would I? Yeah, that sort of thing, right? Even if you want some doctrine of signature, the common acid in our body, HCl. Salt goes in, what comes out is salt. It keeps its image, it keeps its dignity, it keeps its integrity, nothing happens to it. Natrum carb goes in, it becomes salt, it becomes water, it becomes CO2. There is effervescence. Completely disintegrates, no sign of that original molecule anywhere. So this is the graceful withdrawal, and that is the dignity that natrum more holds on to. I won't bend, right? Natrum more, if you see the what is this? Keynotes, sorry. Keynotes, radar keynotes. Emotional vulnerability leading to introversion. Close person, intolerant of grief. Okay. Great sense of responsibility, integrity, turn on emotionally safe. Okay. Tries not to show emotions to maintain control over their circumstances. Whereas natrum carb is refined and sensitive. Aversion to certain persons. Considerate, integrity, dignity, and selfless. And there is one, cheerful, keeps up a facade. This cheerfulness is like a wall, a beautiful decorative wall, a facade. You can't seem to penetrate that barrier and see inside. That's why again you feel, hey, what is wrong? Why are you so happy and still sick? That is the tip. That is the tip that you should take away today. When you feel while taking the history, banda to bahut khush hai yaar, how everything is so good in his life, and how is he not? Why is he sick? Why is he developing so big pathologies? Then you can think of natrum carb. You can. There are a few other remedies. Natrum carb is one of them. You can check in that direction. Belladonna is came up a lot. Belladonna is cheerful, of course, but belladonna is frivolous. They don't persevere with a line of treatment for a long time. They are like, 2 days and it's still not better. I rather go for something else. I'll put tuna on it or something. Like some foolish things they'll do. Frivolous. Yeah. And they, with deeper pathologies, you will confuse them more with pulsatilla because they'll cry one moment and they'll be happy one moment. Right? Belladonna has those in our materia medica, that sudden manifestation. So emotionally also you'll see the sudden changes. She'll be laughing one moment, you change, crying one moment, you change the topic and she'll be laughing. Yeah. Carcinosin will have the feeling that the IPR has done something wrong to them. They have suffered wrong from the environment. Though they keep their spirits high, though they keep themselves, yes, whatever the problem, I'll overcome it. They do complain, no, I have been dominated or I have not received the appreciation that by the environment. It is in the rubric delusion, wrong, suffered he has. Natrum carb does not realize that whatever wrong is happening in the environment. Therefore, they're never going to tell you. Right? So, we'll take questions now.
All right. Thank you, sir. That was such a beautiful session. In fact, I got lost. Matlab such minuscule comparisons between remedies. We've never seen this facet of natrum carb. So all of you, if you have questions, you can type in the Q&A box. So far, we have, sir, two important questions. One is from Dr. Sai Harsita. They want to know, so please suggest a book which they can refer to understand a particular drug in this depth, in the depth that you've explained.
Okay. HHF books are available. There are 8 books. So there are 3 books by Dr. Krishna Kumar Dinde sir, 3 books by Dr. Mayuresh Mahajan sir, and one by Dr. Pallavi ma'am, who spoke yesterday, and also by Dr. Yogesh Rajurkar sir. All very practical. You will see cases and how the rubrics were applied, what is the meaning of those rubrics, when to take, when to not, and close differentiations. All this you can get from these books. Other than that, all the mentors are available. Almost all the mentors are available on YouTube. Their all the names that I've taken, they are there on YouTube. You can go check their channel, understand the remedies. Yes.
And obviously, students learn better from case illustrations when they see
Sure.
others' experience, when they read about other people's experiences, other the seniors' experiences. They learn better. You tend to
Yes.
learn better rather than going through mathematics and everything. That's
Right.
more theoretical. Here, you get a practical aspect of that.
Absolutely.
And of course, Homeopathy 360 is always there. We'll keep bringing such beautiful teachers, such amazing teachers to you on this platform, so you can always subscribe to Homeopathy 360. Okay, another question, sir, we have is from somebody. They've not written their name. Was the dressing continued during your treatment?
Yes, yes. Dressing was continued. He was going to that same surgeon and he was getting the dressing done. But no other oral medications like antibiotics or anything, nothing was given apart from our medicines or the fillers that were given earlier that speeds up healing and all those things were stopped and was exclusively on homeopathic medicines, that is Natcab and SL.
Sir, if you can repeat the name of the books again.
There is beginner series 1, 2, 3 by Dr. Krishna Kumar Dinde sir. There is Little Angels, Managing Pain with Sweet Pills, and the third,
That's by Mahajan
Mayurish
sir.
Mahajan sir.
Both of them.
Both of them. And the third, I have Prescription, also a book on psychodynamics by Mayurish Mahajan sir. Going back to the roots by Pallavi ma'am, and the case before case taking by Dr. Yogesh Rajurkar sir and Dr. Krishna Kumar Dinde's latest book, Behavioral Materia Medic. Yeah. So these are the
One of
books.
his books is Mind Rubrics also, sir.
Yes, yes, yes. Those come in
The
the first three beginner series book.
the beginner
Series
series. That's an
adaptation.
amazing book.
Yeah. Yes, yes, 100%.
Okay, so people are asking where do we get PDFs of these books? So these books are available with BGen. And you will have to buy the book. You will not get PDF. You will
Yes.
have to buy the book and go through them. Really work hard on them. Potency selection in chronic cases. Sir, if you could explain how to select the potency in the chronic cases.
Potency selection is a very big topic altogether, but for every person it will differ. Again, individualized. But general rule of thumb: the better the energy of the patient, despite the pathology, the higher the potency. Whatever pathology the patient may come to you with, if the energy of the patient is high, means he's able to sit, he's able to talk, he's doing all the gestures, his presentation is energetic, you can go higher. The clarity of the medicine is good, you can go higher. And if the patient is bedridden, low vitals, low, you go low, potency low, potency low. General rule of thumb.
Sir, another question is by Dr. Devyani. How can we differentiate with olive sac?
Olive sac, very good. Olive sac is a person who leaves everything to God, who loves God, who like has never received love in his life and seeks that love from God. And he says, if I had asked, what went through your mind when you were told ki your legs are going to be cut off, your toe is going to be cut off? He said, if it is his wish, let it be. Tranquility reconciled to fate and thoughts about confidence in God. And so this is without God, without the religious aspect, without the spiritual aspect, you can't get olive sac, because olive sac, the source material is what? Dhoop. It is used in every religious institution, Hindu, Muslim, Christian, Jewish, every. So without that God wala aspect, you won't find uh, olive sac.
Sir, another question is what potency should be given in cases where there is paralysis?
Again, if you see paralysis, the patient is bedridden, but see some patients, they lose hope. They are waiting to die. Some are like, I'll fight it out, come what may. So depending on the emotional sensitivity, the energy of the patient, you start low, you increase, or you start with 200. If the patient is very, very weak, exhausted, cannot even move a finger, you go LM also. So it all depends on the energy of the patient, individual case.
Uh, Okay, any more questions? DD with spongia.
Spongia, very good.
Dr. Aditya wants to know.
Spongia, you feel that vivacity, that intensity of this thing, na? Natrum curve keeps a distance, that dignity. And Spongia is like, I will give you high five in your clinic, and he'll be like, "Arey, this happened and that happened," and he'll be extremely expressive because he feels that he's surrounded by friends. Everybody is a friend, and they're very. You want to know Spongia? You watch Jab We Met Ki Karina. The way she expresses, the way she talks to the strangers, everything is just, there is no filter of the brain. It's from the heart. She just goes on. So that is Spongia, and you won't feel that uh, dignified part in Spongia. In fact, you find it a bit pushy, a bit forward, a bit cheeky, and this is what pert is. So Spongia is pert, right?
Okay, another question by Dr. Rani. Will a Parkinson case be cured with homeopathic treatment?
I won't be able to comment on that because I have a patient currently and he's doing well. I can't say he's cured, but he's his progress has stopped and he has maintained a bit of, he is able to get a bit of control. Unless I've see a case completely cured, I won't be able to comment. Sorry.
So probably Sir has been able to manage Parkinsonism
Yes. Yes.
and not yet cured, but we'll let you know
Yes.
on the updates in subsequent webinars with him. Says Staphylococcus agria, DD with Staphylococcus agria and Podophyllum and
Okay.
opium.
Podophyllum opium Staphylococcus. Staphylococcus first is very egoistic remedy. Though it is a very sweet, polite person, they are quite egoistic. The things they use, if they see the list of things that hurt him, there is an indignation, mortification, scorn, etc., etc. Everything is there. So they feel they are indignated. They feel that they are wrongly accused. They feel that they are, insulted in front of people, and they feel it very painfully. Yes, and they will tell you that this such and such incidences happened. And while NatCab don't realize these things, and they go into fits of rage, Staphylococcus, and break things. They'll throw things. And this you won't see in Natram card. Opium again is very relaxed. You ask the IPR and they will say, I don't know this person. I don't understand him. He reacts to nothing. That cheerfulness you won't find. You see a stagnant person. Like,
So
it's a
DD with
placid.
sulfur.
Pardon me?
DD with sulfur is another question.
Sulfur. Sulfur is again extremely egoistic. Is the king. So he is the provider. He is the person who provides for everyone. And once his ego is hurt, he knows it and he will let you know. Again, Atramkar does not realize these things. Ailments of egotism, sulfur.
So if you can please repeat podophyllum also, because I don't know, some people missed podophyllum.
Podophyllum.
Or I did, I don't know.
Yeah. Podophyllum is in the rubric. What is it? Tranquility reconciled to fate, again with olive sac. If you put two rubrics, that tranquility reconciled to fate and truth telling the plane, you get only two remedies, that is olive sac and podophyllum. Now certain remedies may be added, but these two are the ones that used to come up. Podophyllum does not want quarrel, and they also just want to, you don't quarrel, do whatever, please don't quarrel and maintain harmony. They want peace, right? And they realize what is wrong with the environment and they correct them. They are in the rubric rectify desire to. They try to correct them. Unless you identify what is wrong, you can't correct. Right? So they try to correct the husband. There is a tinge of haughtiness in podophyllum also. You will find it in the rubric haughty and true telling the plain. So you won't have to fish for what is wrong with you, what is wrong with you. You will get that information upfront.
Sir, then Dr. Pushpa Bhagat, she wants to know, please explain with such mental state, how did natrum carb land into such a pathology?
That's what. See, this is the problem with natrum carb. They feel they are good. They feel they are content. They feel that everything is good. They feel they are thick, that nothing bothers them. But it is their conscious feeling. Na? They are repressing every emotion, and that is more dangerous than suppressing emotions. Voluntarily suppressing emotions, you can voluntarily bring them out also and act upon it, but they don't realize it. All those negative information is just going into the subconscious, and that thereby they develop pathologies. That question
DD with
should come.
calcare.
That question should come into your mind. Why? Why the hell are you sick? You feel frustrated when you see an natrum carb patient, and then you think, could be natrum carb.
So then Dr. Maninder Kaur, DD with calcarea carb.
Calcarea carb is very different. He is more interested in showing how great he is, how much of a big shot he is, how exclusive he is, what a great person he is. So he's more interested in that. Though Calcarea carb is there in the rubric dignified, Calcarea doesn't really qualify for being dignified. He's such a big boaster. I'll give you an example of Sunil sir's case. This person was diagnosed with cancer and he was admitted in the Nargis Dutt hospital in Karad or somewhere. And you ask him the history, and he was proud of the fact that he got the same bed where Nargis had, and he was, कौन से बेड पे था? नरगिस के बेड. What are you proud of? Huh? Kalkiria can't find any little thing to be proud of and feel excluded.
Sir, another question is important remedies that you use to manage Parkinson's case.
Parkinson's, you can't just label Parkinson's and these are the remedies, and that is allopathy. You have to individualize the case, what landed this person in Parkinsonism, and then you have to prescribe accordingly. So
you have to take the case, then individualize the patient,
no
because your remedies will vary. They
100%.
obviously will vary from case to case.
Yes.
Dr. Zoesh Patel, please explain repression and suppression, how to differentiate between the two.
Differentiation, see, it won't help you in case taking, but to understand NAT curve, you have to understand this. That was the idea. So repression, of course, if you see a lot of pathology coming up, a lot of diseases coming up in the patient, and you're not able to correspond it to anything wrong in their life, no corresponding emotion, no corresponding life situation that may have landed them into such bad situations, you can think that this person has repressed his emotions and that's why he has landed in such pathologies. Of course, it is not something that would help you in prescription, but it helps you understand natrum carb and why he, despite being in such good phase of his life, apparently, he's falling sick. Right?
Then we have Dulcamara.
Oof, Dulcamara is miles apart. Dulcamara is very explosive. Dulcamara would shout her lungs out at her husband if he's not giving enough care. The people from the next building will know what's going on in their house. She's so angry. She उनको समझाती हूँ मैं, ऐसा मत करो. She will go and it's a very angry, very robust remedy, and they won't suppress their emotions.
Then another question is, sir, as you just explained Calcarea carb and how he's haughty about things and proud about things. So This person wants to know then what is the difference between platina and calcarea carb if both of them,
Very good.
the
Platina
pride of
doesn't
both
have a
of them.
need to show that he is out of this world. He is what he is. Hum hai, baki sab pani kam. He just comes, he sits, he has that aura, he has that look, and he doesn't need to show that what he was in Nargis or whatever. He doesn't need to. Boasting there will be, it will be very subtle, and you feel like, oh my god, he's whatever he's boasting about is worth it. Like my tennis elbow is being taken care of by Dr. So and so who managed Sachin Tendulkar's tennis elbow. And my IBS is taken care of by the person who is treating Amitabh Bachchan. And I'm here for the weakness if you can handle it. Thank you, sir. आपने आपको ये opportunity दिया आपका weakness handle करने का. That's what you feel. Like he is putting you down. That haughtiness. And he knows who he is. He doesn't need to show and boast and anything.
Then Dr. Nancy Malik wants to know the psychodynamics of adenoids.
Adenoids. You're not allowed to be you. You're not allowed to breathe free. Your parents have put lot of restrictions on you. नाक में दम कर रखा है. अभी I don't know how to say this in English, but नाक में दम कर रखा
Your
है.
pain in
Your
pain in
pain in my nose.
kind of pain in
So you're not allowed to be you. You're not allowed to breathe freely. As a child, you're restricted a lot. And that could be one reason.
Then sir, Dr. Shehnaz wants to know DD with mag carb.
Mag carb. Mag carb is an orphan. They feel the need of others. Whereas natrum carb is happy alone but dignified. Mag carb is orphan. They need the presence, and carb element relates to the father, and they need the affection and appreciation and acknowledgement from the father. And from all the magnesiums, mag carb is the most angry one. They can express their anger.
So now we are getting too many questions on psychodynamics of different things, psychodynamics of autoimmune diseases, psychodynamics of abdominal pain. I don't know how far would that go, because ऐसे तो we'll have different conditions.
Never ending streak. If you start discussing psychodynamics, psychodynamics can't be taught actually, because you think about what the organ is supposed to do, what that part indicates in your social setting. You think like a layman most of all, not like a doctor, if you want to know the psychodynamics.
For example, sir, a few examples if you can give, so people will understand and they'll know how to apply psychodynamics to different cases.
Shoulder, for example. Shoulder pain. What does shoulder indicate if you're a layman? आप कंधे पे क्या लेते हो? What do you shoulder? You shoulder
Answers,
responsibilities.
please. If
You shoulder responsibilities. So there is a right and left. Right is your business, your partner, your spouse, and left is you yourself, your immediate family, your brothers, sisters, children. So when you take on too much of responsibility or feel like it is too much and I'm not able to cope up with it, you get this right shoulder pain if it's related to business, and left shoulder pain if it's related to your household responsibilities. Just a general example. It's not so simple, but for our understanding.
okay, so again, psychodynamics. Too many questions on psychodynamics. Sir, would you like to, give them some books or something where they can find?
Mayuresh sir's book called The Third Eye of Prescription. It is majorly it is on the topic of psychodynamics. We have the lecture series Brahmastra also going on, going deep into psychodynamics. Psychodynamics is something that gives you an extra edge when it comes to pathological cases. You can go in the opposite direction.
Okay, so sir, if you can please repeat for all of them because this went on very quickly.
Acha.
The name of the book and
The third eye of prescription.
the third eye of
Third eye of
prescription.
prescription by Dr. Mayuresh Mahajan sir, and Brahmastra series by HHF, webinar series. So we are done with arthritis now. We'll be coming up with other diseases, and through cases, through examples. It is something that will guide you. It won't give you an exhaustive list of this organ means this emotion, no. But you will be able to think for yourself कि नहीं, अगर ये उंगली affected है, ये उंगली affected है, तो क्या हो सकता है? What could be the reason behind it?
Okay, and because the series is going on with Homeopathy 360, so soon we'll have hopefully if sir can find time, we'll have sir on board and we'll be doing a webinar for all of you. So please do subscribe to homeopathy360.com.
Yes.
And any more questions, please you can type other than the psychodynamics of different conditions because I think again as sir says that's a never-ending streak. So. Um, Sir, differentiation with lycopodium.
Lycopodium would never give you a straight answer in your. You may confuse it a little bit. You ask what is wrong with your life, what is wrong with your life, and he'll give many different answers, but you won't get anywhere. You're like, what are you trying to say? I mean, you ask a patient about your relationship with your wife, and he would be like, now, she has a little bit of thyroid issues, and my mother-in-law's mother is also not well. So they don't sometimes get along. But I took my mother to the clinic at the hospital, and they were okay. They were kind of, it's okay. What did you get? What answer do you get? Nothing. This is answering evasive. They don't give you an answer. They give an answer, but they don't give you an answer. They don't give you anything. They are very secretive and they don't let you in on their true emotions.
Sir, there's one point raised by Dr. Akanksha Rana. Does asthma also can boil down to too many restrictions put on the child on the
Yes,
patient since childhood?
yes. Many a times you see the progression. No? It started as adenoids and then bronchitis or asthma. They go down that way. Yeah. So asthma is also restriction, not being able to breathe freely. You ask
Okay,
in
any more
cases of asthma with for psychodynamics, you ask आपकी जिंदगी में घुटन क्या हो रही है? What is suffocating you? And then they come up with like, nahin, my husband doesn't allow certain things, or my parents don't allow, or my wife doesn't allow, whatever.
Okay, any more questions? Sir, is the case same with polyps also? Asthma wala.
Polyps usually are a mass and it bleeds. It could be related to your dignity also. Yeah? And your ego or your dignity or self-respect is hurt. Could be also the person, how he has reacted to the situation also matters. What are the symptoms that has developed because of the polyp also matters.
Another question by Dr. Sonal Arora. You said that after natrum carb, there won't be any change in the behavior. So
Because
why
you
is that
never,
so?
why? Because you did not get anything to prescribe on his mental level in the first place, na? So how will you decide that that has changed? He may become a little more, what do you call it? Verbal, maybe, but you don't get that sort of change because you don't get it in the first place, in the consultation itself, that there is some problem with his mentals. I probably I miss, I did not say it out properly. You don't see that change. It may be there, but you don't see that change.
Sir, we are getting so many questions on DD with this, DD with that. So if you could tell them some books to refer to where they get to understand the comparisons, these minor comparisons between remedies.
Again, all these things I've learned from HHF only. So definitely we are to refer to our masters or pioneers, all of them. But this way of thinking is, I think it is there in HHF only. And I have learned it from HHF. That's what I can tell you.
So okay, so that is why we have this series going on with
Yes,
different
yes.
mentors of HHF, because this bridges the gap between you and the mentors of
Do
HHF,
not miss
because
tomorrow's session. The master of how is coming, Dr. Gopinath Menon, sir.
absolutely.
And he prescribes like that with minor change
Absolutely.
in gestures, and his understanding is out of this world. You will learn a lot from.
I was about to announce that. So all of you can register for tomorrow's webinar also, because in this series, which is coming in collaboration with HHF, tomorrow we'll be talking to Dr. Gopinath Menon sir, and we'll be talking about skin alopecia, homeopathy in skin alopecia. And then on every month, we'll be having mentors from HHF on a regular basis every month. So you can go on subscribing to Homeopathy 360, and you can go on learning through these webinars with HHF. And of course, HHF is always there. You can directly see their webinars, and talk to different teachers through their YouTube channels also.
Yes, yes.
And
Let me just
okay,
say my
people are asking,
gratitude.
is it free, sir? Ours is free. Ours is obviously free. About HHM webinar, sir will be able to tell us better.
Uh, yes, HHF webinars. There are free webinars also that happen. There is HHF Feel Facebook group that you can join, and you'll get all the notifications. There is a Telegram group where you can join and have case studies daily that's happening from different mentors from different parts of India. They are putting up their cases, their understanding. You can learn from them. There are paid webinars. There are seminars that happen throughout Maharashtra, throughout India, and all those notifications you can get on the Facebook page and also on the Telegram page, and you can go there and choose the webinars and study materials to your likings. The Facebook page itself has a lot of material. You can put in phosphorus and you'll get sessions on phosphorus. You can put in natrum carb, you can get sessions on natrum carb, and it is absolutely free. You can do that as well.
Okay, so I hope where to register for Homeopathy 360, you can simply log on to the website. You have YouTube channel where you can subscribe to the YouTube channel. Then do we have any more questions? If you have any more questions, please type in. I think so that is it. We should be winding up.
Thank you so much. Thank you so much, everyone, for listening so patiently and actively participating. Thank you, Dr. Rashi and Dr. Mansi
Thank you, sir.
Kenny, BJN, and Homeopathy 360 for this platform. And of course, gratitude to my family. Uh, and these are my details. If anybody wants this, they can message, mail. Yeah.
The recording of this webinar will be available on YouTube channel of Homeopathy 360. So any of you who've missed it, you can watch it there, and you'll be getting your participation certificates that they will be released within 2 days from now. And I think that is it. Let us wind up. We'll meet Dr. Gopinath Menon sir tomorrow, and it will absolutely be our pleasure, and of course to the pleasure of the students also. It will be a session of great learning.
100%.
So thank you, sir.
Okay.
And
Thank you
thank
very
you, all
much.
of you. Good night.
Good night.